A montage shows kids playing, learning, eating, and exercising at school. Text, WSCC, Whole School, Whole Community, Whole Child. A collaborative approach to learning and health. National Association of Chronic Disease Directors, promoting health, preventing disease. WSCC benefits and impact on student learning and health. The WSCC model, developed by Centers for Disease Control and Prevention and ASCD, shows a child at the center surrounded by a 5-point star labeled healthy, safe, engaged, supported, challenged. Then, a ring around the star reads, coordinating policy, process, and practice, improving learning and improving health. The next ring is divided into segments for health education and physical activity, nutrition, environment and services, health services, social and emotional climate, counseling, psychological and social services, physical environment, employee wellness, family engagement, and community involvement. The entire model is encompassed within community. Jennifer Schrader, Governing Board Member and Parent, Stanfield Elementary School District, Arizona.
As a parent of 3 children, when I send my kids out the door in the morning, I want to know that not only are they going to be kept safe, but I want to know that they're going to be cared for.
Students play soccer on a sandy playground. Josh Mybus, MEd, Physical Education Teacher, Crockett Elementary School, Arizona.
I always like to think of it as rather than us trying to have the kid fit into the system, we're challenged with an opportunity to how can we get the system to fit the kid.
A school bus pulls up to Springfield High School. Will Fritsch, BSN RN, Public Health Nurse and School Liaison. Vermont Department of Health, Vermont.
The benefit of rolling out something like WISC is that we're coming at an issue from the perspectives of medical providers, schools, public health folks, and so much more, that we can really look at almost every aspect of an issue and work toward our goals in a more comprehensive way.
Text, Meeting Diverse Needs. Chris Lineberry, Ed D., School Principal, Stanfield Elementary School District, Arizona.
From their health, their wellness, their emotional health, helping them deal with trauma, meeting their needs, making sure they're fed, and helping them to reach their fullest potential in all aspects of life. That's what our real purpose should be about. How can we serve kids to their greatest benefit?
Students carry trays of food through a cafeteria. Banners display awards for active schools and America's Healthiest Schools. Sean Hannafin, School Principal, Crockett Elementary School, Arizona.
It's about the whole child, not just the academic piece, which we can always try to connect them to. We describe it as a win philosophy, so a what I need philosophy, that each child's kind of unique. And so because we have so many programs, there's really something for everybody.
A nurse examines a student. Text, Acting on WSCC Components. Jennifer Schrader.
We're really pushing to try and do services for these children and for the community as well. We've been pushing for dental. We have a new grant with Sun Life, so we're going to be getting some healthcare services on our campus. We provide counseling services, sometimes for both the children and the parents. All of our kids eat free breakfast, free lunch, and if they're here in the evening, they get a snack.
A student gets a dental exam, and parents peruse flyers about health and nutrition. Tammy Stagner, parent, Springfield School District, Vermont.
Even if it's for a yoga break that has been incorporated in one of my daughter's classes, or a extra morning recess in my son's primary elementary schools, it's just proven that they need to get up and move.
Students play indoor hockey, then close their eyes at their desks. Victoria Laureano, 6th grade teacher, Crockett Elementary School, Arizona.
We have so much up here, but let's pull it down and come back to what we need to do. After we have our mindful moments, they're ready to go. They understand that it's time to learn, and it just really sets up the day.
Text, Improving Learning and Health. Melissa Sadorf, Ed D., Superintendent, Stanfield Elementary School, Arizona.
It's not a secret that students that are healthy learn better. So providing nutritious meals at the cafeteria, making sure that they have regular access to physical activity because we know that a lot of our students don't. Making sure that they do have access to counseling service as necessary. Those are things that have definitely had an impact not only on our academics, but they've had an impact on discipline levels here at the school site.
Students work out on exercise equipment, then eat in the cafeteria. More students meditate at their desks. Sean Hannafin.
It was a hard decision to go away from our meetings being all about academics to moving towards social and emotional side of our students. As we moved in that direction, teachers started to see their students writing more, answering questions and moving towards full sentences. So by putting that piece forward as far as the whole child method, it allowed us to become even stronger in the academic piece.
Josh Mybus.
At any day after school, we have quite a few after-school programs going on. All of these are relevant to what they want to do. I feel like keeps them coming back to school, keeps our attendance high, keeps these kids interested in what's going on at their school, keeps the parents engaged as well.
Students play baseball, then sit in a circle outside. Adults work out in a school gym. Jenny Anderson, MEd, BSN RN, school nurse, Springfield High School, Vermont.
A lot of the faculty are living healthy and they are really great examples, and they promote it in their classrooms, so keeping them hydrated, being outside, having the brain breaks. Those kinds of things have really helped kids to stay more focused in their academics.
Text, moving students forward through WSCC. A student runs on a treadmill. Jenna Knight, 12th grade student, Springfield High School, Vermont.
When you start young and you kind of like keep this growing up until their senior year of high school, they have this idea in the back of their head that students need to stay healthy, they need to stay active, they need to go outside. And especially like once you're senior and you graduate, you're an adult, like your health and wellness is in your hands. So having this idea is super important for young adults who are taking that next step in their life.
A student takes a piece of fruit from a bowl. Jeffrey Smith, Ed D., Superintendent, Balsz School District, Arizona.
Now we're starting to change generations and how they see food, how they see learning, how they see active living in their lives. That's the real measurement of how we're doing, I think.
Visit chronicdisease.org/schoolhealth for videos and more resources to help you implement the WSCC model. A logo, National Association of Chronic Disease Directors. Promoting health, preventing disease. Facebook, Chronic Disease Directors. Twitter, @NACDD Info.